Namaste. On behalf of Apollo Hospitals, I'm delighted to welcome you to yet another session of our corporate health series. As you know, aims to bring focus on health issues that you, as part of the corporate world, are at particular risk for. We hope this series helps you to function at the peak of your productivity with minimum stress and maximum well-being. Human life for millennia has been intricately intertwined with the ebb and flow of the seasons. These cyclical transitions have a profound influence on human health and mood and behavior. It governs sleep patterns, energy levels, our infections, and even our mental well-being. In our country, we have summer, monsoons, and some parts of the country experience a winter too. We do need to understand not only how our body and mood changes according to the weather, but also specific conditions and infections and allergies that can strike during specific seasons. Most of the country is now experiencing the monsoons. As the skies are turning grey and we smell the fragrance of raindrops and wet soil, the air becomes cooler, bringing us relief from the scorching summer just gone by. The earth turns lush and green, and we are overcome by that sense of joy of wanting to splash about, eat hot street food, drink a lot of chai, dance in the rain. But in order to enjoy the monsoons without falling sick and feeling miserable, it's important to know what diseases are prevalent during our monsoons and how best to anticipate and prevent them. During the monsoon season, the risk of infections are higher than any other season, and it's also ideal in this season for bacteria and viruses to flourish. There's a lot of moisture in the air, there's a lot of dirty water on the streets, and all kinds of infections can happen. So to talk us through and advise us on how best we can take care of our health during monsoons, and also in general to discuss seasonal health problems, I'm very happy to welcome Dr. Shreevidya. Dr. Shreevidya is an internal medicine physician and a senior consultant at Apollo Hospitals, Chennai. She is a dynamic internist, diabetologist, women's health specialist, boasting over 2 decades of enriching experience in the medical field, particularly in preventive health and women's wellness. She's been a pivotal figure in Tamil Nadu's COVID-19 response, and she has notably contributed to crucial pandemic management initiatives. Dr. Shreevidya is an alumna of the Mahatma Gandhi Institute of Medical Sciences, has had a distinguished career featuring roles at Apollo Hospitals, MGM Healthcare Chennai, the Adyar Cancer Institute, and several other esteemed medical colleges. Her vibrant professional life is matched by a passion for clinical research, trekking, corporate health management, art, and paints a picture of a doctor who's versatile and skillfully blends her medical excellence with a zest for diverse life experiences. She plays an important role in managing the preventive health program of Apollo Hospitals as well. Welcome, Dr. Shreevidya, to this session. Thank you so much for joining us.
Thank you, Dr. Srinidhi. I really like the way you describe me.
Absolutely. So let's go on to seasons, and we will talk about our current season first, what we are undergoing now in India, in some parts of India at least. I know it's still not the monsoon season in Tamil Nadu. But what are the common monsoon-related health conditions and diseases in India, and what really, does it affect everyone?
So the common ones are the routine respiratory illnesses and the acute diarrheal illnesses, the two main system which takes the brunt during the monsoon, because they are very highly contagious. They're very, very highly contagious. And there are some sort of skin infections also which come about specifically during the monsoon, right? Well, the age group which gets affected is either very elderly people, our geriatrics and our pediatric, and maybe some adults who are in and around these two age groups, essentially.
So why do these diseases, these infections spread more during the monsoons, you think?
So the first thing about monsoon is that there is an increase in humidity and what to say, congestion. So there is a lot of dense in the air, denseness or humidity in the air. So what happens is that when the first rain hits the soil, all of these dormant viruses and bacteria, which are otherwise kind of settled down in the ground, just come to your breathing level, and then you start developing. It stays in the air for a very, very long time because of this increased humidity. The second is the water contamination. Because of overflowing of all the water bodies, your sewage system gets affected and it gets mixed with your normal potable water. And that is one of the biggest source of water contamination. The second is lack of sanitation in India. Even though we know that we are supposed to wash our hands religiously after using it in the restroom and toilet, this habit of using sanitizer has become quite prevalent, but nothing replaces soap and water. Nothing replaces soap and water. The third thing is the lack of immunity. There are, like I said, this vulnerable age group will always have some immunity low, some anemia, some gastric disturbances which can be triggered off. And the last but not the least is the congestion inside the houses. To avoid rain, people tend to stay clustered together and the infection keeps traveling between these people. These kids go to school when they are better, again pick up a resilient infection. So this cycle keeps on going till they probably outgrow it.
So what would be the common, would they be like, I mean, you did say respiratory and diarrheal diseases, like, is it anything like, which there is a trend this year that there's a lot of hepatitis A or there's a lot of typhoid or any dysentery and that kind of thing, or it just kind of varies from place to place?
It varies from place to place. Essentially, the RSV, respiratory syncytial virus, and the acute diarrheal diseases are the viral ones, are the commonest one. But definitely entering peaks during this September, from August to September, usually peaks around these 2 months because of using the consumption of contaminated fruit from the market, open food which are available, unwashed vegetables and things like that. It can go to some specific places like Kerala is very, very common for Nipah virus this time. We are coming up with a very type of poxyvirus infection which is affecting the skin. Every year there are these specific ones which crop up, but fortunately they are self-limiting and they kind of die out on their own, and they are heat labile. General measures take care of it. But the major culprit is the common acute diarrheal viruses, and the respiratory syncytial virus, which causes the lung infections. The lung, mostly flus.
So what would your key measures be to prevent these waterborne and foodborne monsoon infections, airborne as well?
One of the most important things which we all need to do is maintain good sanitation. We need to repeatedly ensure that we are washing our hands and ensuring that there is good sanitation. The second is to use the potable water should be kept clean, maybe boiled and used within 24 hours and not reused the next day. The third is to cover all their food items at home, and definitely need to only consume hot food, cooked food, and avoid salads, unwashed salads or over-the-counter food from the market. These are the things about the food. One of the best way to prevent recurrent flu infection is to wear a mask. You never go wrong with a mask. I think COVID has taught us a very, very good lesson that masking is important, taking flu shots, continuing with whatever medications you are supposed to take, and not stop it, especially before the flu season, is very important. People who are vulnerable to asthma and COPD should double their doses and meet their doctors. These are the general measures which we need to follow.
What about specific advice for corporate employees, especially in the context of those who might be out on the field for the whole day, or there might be people who are traveling a lot to different parts of the country where there might be heavy rains and other natural phenomena going on. So there, some of these measures, of course, hand washing is something you can do anywhere. But what kind of food do you think they should opt for? What kind of water should they drink, and what should they avoid?
Yes, hand sanitation, yes. If possible, even if it is a bottled water, because we do not know the source of the bottled water, it is better if they can boil it and use it. That is the second thing. The third thing is to eat simple hot food and avoid non-vegetarian food, like avoid meat, animal protein outside the house, because we do not know whether it is fully cooked or partially cooked. One of the biggest cause for typhoid or enteric fever is animal protein. So we need to be very, very confident that it is a well-cooked meat before we consume it. And it is unknown to create a lot of diarrheal disease also. It can cause osmotic diarrhea, which is being triggered by a viral fever. There may be no connection between the two, but this is what is very commonly seen in monsoon. So eat hot food, avoid animal protein, ensure if you are having even vegetable, it is well boiled and cooked. Avoid eating raw food outside home when you are traveling. Potable water should be boiled. You cannot use chlorine pills which come. So you have to use 2 pills for a 1 liter bottle. Wait for 30 minutes before you consume it. So it kills a lot of those viruses and bacteria, and hand hygiene.
I think now we'll move on to the other common group of infections that happen largely because of the stagnant water. That's the mosquito-borne series of infections, which we hear a lot about. I don't know if they're really monsoon-based, but yes, malaria, filariasis, and then, of course, the dengues and the chikungunya and all of that. But somehow they do seem to be more prevalent in the latter part of the year when the rains strike and it's quite a bit of water stagnating everywhere. So what kind of measures can we take? Because I know it's difficult to change the environment around us, but around our home and within our home, what can we do?
So like you said, the stagnation is always there. But most of the days, other than the monsoon, there is sun also. So the sunlight and the sun heat is one of the most compelling thing which kills the viruses and bacteria. During monsoon, we don't have the facility of the sun. So we need to ensure that there is no stagnant water, which is like open coconut shell, open bucket water, trying to harvest rainwater. These things, there should be no source of open water to avoid stagnation. The second is mosquito-borne diseases. 3 major diseases, which is very prominent in India, is malaria, dengue, and chikungunya. Chikungunya and dengue are again self-limiting. Malaria comes in cyclical form. Now, one of the best ways is to wear a fully covered cotton dress so that, the mosquito bite during the daytime is avoided. And dengue is specifically a daytime mosquito. So, and you can use mosquito repellent, whether it is body repellent or a spray for the house, both work. Essentially, the spray should be in all the dark spaces of the house, because that is where these mosquitoes breed at large. If it is an endemic area, we do tell people to go on chloroquine or proguanil prophylaxis if it is a chloroquine resistant malaria, which is rampant in their state. In Tamil Nadu, we actually don't see as many malaria. We see dengue. What to say? They do. There will be some residual illnesses to handle for the next couple of months. So essentially, for malaria, you have to use something to kill the mosquitoes in the water. So kerosene is a very good way of killing. So it forms a layer and does not let the mosquito breed in the water. Avoid having open source of water storage in the house. Cover the body fully, especially the children who are very, very vulnerable, and use mosquito repellents.
We already touched briefly upon the vaccines that one must kind of make sure that you're up to date before the monsoon season.
It's essentially right now the flu vaccine. If anybody has not taken chickenpox, they should take the chickenpox vaccine at least a month before. There is no vaccine for malaria, dengue, and chikungunya as of now. Hepatitis A is another viral infection which is foodborne, but the vaccination is not really very required because it's again a self-limiting disease, virus. I'm not able to think of anything else. Right?
There's also this leptospirosis, which again is linked to water and contaminated water with rat exuding.
Yeah.
Things like that.
Yes. Again, if it goes a vector, the vector is the rat, and rat carries the leptospira bacteria basically, and then it is running all over the house, and what do we call it? The rat leftovers are what are the bites and all are leaving. So very important again is to cover the food. If you have houses rat infested, or if you see any dead rat around the house, you need to inform the corporation or the cleaning people who come immediately so that the rats are hunted out and killed, because otherwise it can create a big spread in the community. Otherwise, leptospira is actually, we really can't do anything major to prevent it other than killing the rats, but it is treatable.
Apart from the monsoons, so there is a lot of interest now in seasonal conditions, which are not infections, but there might be, we do talk about allergies and exacerbation of asthma or skin or mental health. So would you like to wrap up this session with a brief overview on how the seasons really affect and what we should be aware of?
September was blamed on seasonally affective depressive disorders, and which used to be called as SADS before. Nowadays we don't use it, but yes, definitely there is a cyclical impact. So every 3 months, people who have mental health illness go through a waning and a waxing phase of their mood swings. And very typically in September, October, there are low moods before again the winter sets in. Staying inside the house, getting restricted because of rains and illnesses adds to this burden. Skin issue is very common because hygiene is not as well maintained. There is a lot of sweating which aggravates the allergies. And people who have atopy, allergy basically, whether it is skin or asthma, both get aggravated during the monsoon. Even if it is a small mosquito bite, and that mosquito bite reaction can cause a lot of reaction, atopy, and cause a wheezing flare. So the mosquito is not only causing asthma, it's also kicking the atopy and allergic reaction in the body, leading to wheezing. You don't even realize where it is getting triggered from. Very important is to ensure that you have adequate supplies of histaminic and in your inhalers. You really don't need antibiotics during these because they're essentially viral illnesses or allergic reaction. Unless told by your treating physician, avoid antibiotic and over-the-counter medication it can cause more harm than any benefit.
Absolutely. I think that's a very powerful message there, because I think many of us think that the first sign of an illness, just start the antibiotics and get better quickly. I think that phenomenon will be seen more among the corporate sector too, because don't want to miss out on things and just hope you get better. Yes. Is there anything else that you would like to add to our corporate audience?
It is important that this is a annually occurring problem. Every monsoon, we all fall sick and we become better, we lose our productivity. But then come the monsoon gets over, we very conveniently forget that this can happen again next year. It is very important to build our innate immunity, be very healthy, optimize our weight, ensure that our sugars are under control, because anything can trigger this. A small upper respiratory infection can become a full-blown pneumonia. So very important that we please spend that 1,000 rupees on your vaccine to prevent lakhs of rupees getting spent on hospitalization and less productivity and recovering from diseases. Happy holidays.
Thank you so much for your valuable insights, Dr. Shreevidya. Thank you, viewers, for tuning in, and I do hope you found the session informative. We are always within easy reach in case you need any further service and assistance. You know where to call us. Enjoy the monsoons. Have a song in your heart and smile in your lips. And don't feel fatigued and sick. Take the preventive measures. Till we meet again, stay safe and stay healthy. Thank you and namaste.